Hello, I'm Dr. Hess. By now you're a physician and you have decided to proceed with surgical care for your foot ailment. Since the conservative cares have failed, we're going to go through some paperwork to kind of help you see what's next. First, we're going to go through the history and physical, make sure that all your health issues are handled. We're going to review the consent form briefly so that you understand what it is we're trying to convey, specifically the procedure that's being performed for you, the proposed outcomes of the procedure, such as pain reduction, alignment improvement, things of that sort. We're also going to review the allergies you may have, let you know that we may be taking photographs in surgery, having assistants, students, and anesthesia. As far as the risks of this surgery, there is a risk of infection, although since it's in our surgery center, it's quite low, even lower than most hospitals. Delayed healing. If you tend to do too much postoperatively, you can have a slower healing phase. So we really do need your commitment to do your part. Excessive and bleeding, again, swelling, those things are in your control. You need to ice, elevate, and keep reduction in your activity. Allergic reactions are possible. The most common might be a side effect from the pain medication. Your skin might itch, your stomach can get upset. But for the most part, most of the medications we give you will have unlikely allergic reaction potential. With skin incisions from surgery, there can be some numbness along the incision site. Most of this resolves with time, and it's unlikely to actually happen. But we want you to be aware of that possibility. With the general medical complications, these are very unlikely. There is a risk of blood clot, but we have you take an aspirin a day to keep the blood clot away. And so this is really important postoperatively to take that baby aspirin a day. As far as the chance of this problem returning, most conditions we can treat very successfully, and chance of return are very low. Our anticipated prognosis, of course, for your surgery is good. Once in a while, if there's an arthritic joint, there is a chance that this will still have some arthritis pain after surgery. But most of these surgeries have a good outcome with your commitment, like I said. We'll have you sign the consent form. We'll have a witness sign it once you've understood all of the items listed on this consent form. When we review your history and physical, we're going to need to know your current medications, allergies, previous surgeries. The nurse will go through those specifics with you shortly. As far as postoperative instructions, we'll review those with you shortly. But know that we're going to give you our cell phone number for whichever doctor is doing the surgery so that you can contact us if you have any concerns. Also, if you can't reach anyone, you can always call our office at 754-3338 and have us paged. By going through all this information, we're hoping to give you a good outcome.
The first piece of paper I would like to draw your attention to is entitled Surgeries. As written before you, the offices of Foot and Ankle Surgical Associates house privately owned ambulatory surgery centers. The owner is Dr. Terrence E. Hess. By law, we want you to know that you may have your surgery performed at many different locations as listed on this page. We, as well as our patients, prefer the surgical center located in our offices. We meet all the standards necessary to offer and provide the same sterile, excellent surgical care to you and all our patients. If you understand your rights regarding the location of surgery, please sign the space below. If you have any questions, you may address them to your nurse or physician when they return. Next, we will be discussing the post-operative instructions with you. To ensure you are the most comfortable and heal in the most timely fashion, we ask that you follow these instructions after your procedure and call the office if you have any questions or concerns while at home. I will first draw your attention to the top bolded item. This is a list of symptoms or conditions that, if you experience, are considered an emergency and you need to contact our office immediately. If it is after hours, you are to call your physician at the number listed at the top of the instructions. This is their cellular phone, and they will answer this call. The first is if you experience any calf pain. A concern with surgery below the knee is for blood clot to occur due to the immobility and trauma from surgery. If you feel short of breath or experience any calf cramping or pain, call our office immediately or call 911. If the bandages become overly stained with blood or the bleeding does not seem to stop within a few hours after your procedure, call the office immediately to be seen. Ultimately, we want you to be as comfortable as possible, so the medication we send home with you is designed to provide comfort during the first few weeks of surgery. However, they are not designed to give you a green light to increase activity. This being said, if you are unable to control your pain with the medication prescribed, call our office immediately. Sometimes it is as simple as trying some different things we can direct over the phone. If for any reason you bump or fall on your surgical site, call our office. We may need to take an x-ray to ensure there is no damage to the bone fixation or surgical site. If you develop a fever that is greater than 101 degrees, call our office immediately. This is a strong indicator of infection. You need to be seen to ensure there is no infection, and if there is one, it can be treated immediately. If for any reason the bandage becomes wet by your doing, call the office. We need to change the dressing to prevent any infection or delayed healing. If you are using an ice machine, you may feel dampness from the condensation of the pad. It is not, however, normal for your bandage to be soaked or dripping wet. If this is the case, you may have a leak in your pad and it needs to be changed immediately. The items we have underlined so far are serious issues that need immediate attention. But please, feel free to contact us with any concern or question. Contact the office first, or if after hours, please call the physician on the number listed. The remainder of the items listed in this page are things that will help you heal as quickly as possible and ensure you are as comfortable as possible. Aspirin helps to serve as a blood thinner, therefore serving as an anticoagulant during your post-operative period. If you are already taking a baby aspirin, you do not need to take any more. And if you have asthma or any allergies to aspirin, do not take aspirin. Continue one baby aspirin daily for 6 weeks post-operatively. Go home immediately following your surgery and elevate your foot for the first week. If you're non-weight bearing, you are not to place any weight on your foot or ankle at all. You are not even to place your foot or ankle on the floor. You need to elevate and support using pillows. If you are minimum weight bearing, you will want to stay off your foot and ankle as much as possible for the first week. We suggest taking time off work if possible. The first week is crucial in the inflammation and healing process. During your follow-up visits, you may receive further instructions regarding weight bearing, but the more you are on your foot, the greater the chance to injure the surgical site and delay healing. If you leave the surgery center with a boot, remain in the boot until you are seen again. This will ensure the bandaging and fixation remains intact and no problems occur. If you are in a plaster splint, you may place a cardboard box over the splint to protect your foot and ankle while sleeping or sitting. If you've been given an ice machine, fill the ice machine up to the ice line and finish by using water to fill to the water line. You will only need to turn and plug the machine on and make sure it is turned on all the way up. The machine will cycle on and off. This is normal. If, however, the machine does not turn back on, or if the machine does not work, call the office immediately and we'll replace it for you. If you are not using an ice machine, you will need to place ice on the surgical site. To do so, place ice in a plastic bag and wrap a towel around it. Place the ice over the site for 2 hours and then remove it for 1 hour for the first 3 days. It is normal for swelling and drainage to occur at the surgical site and limb. The more you can elevate, the less swelling will occur. Occasionally, the skin may take on a bruised appearance. Don't worry, this is normal. Just elevate your foot. You will want to keep your bandage clean and dry, and do not remove your bandage if there is pain or irritation. So call the office immediately. Your bandage will be removed at the first appointment following surgery. Occasionally, the removal of the boot or overlying ace bandage can help to relieve some pressure caused by the swelling. But this needs to be done non-weight bearing with your foot elevated. You may cover your bandage and hang your leg outside of the bathtub to clean yourself, but you must not take a shower. No matter how hard you try, the area will usually get wet. Over your recovery, you will want to exercise your legs frequently by bending your knees and helping the circulation to your leg. This will speed up the healing process. All prescriptions should be filled before the procedure so you can begin taking your medications as directed before your anesthesia fully wears off. Have the medications with you at the office the day of the surgery. If during the course of taking your medication you experience any symptoms such as upset stomach, headache, rash, or other abnormal reactions, discontinue taking your medication immediately and call our offices. You will want to curtail the use of alcohol or tobacco during your recovery. These can interfere with use of your medication as well as delay the healing. Ultimately, you need to elevate your leg and get plenty of rest. Drink plenty of fluids and eat your normal, well-balanced diet to ensure a good recovery. Again, call the offices if you need anything, and call the offices to confirm your next appointments. On the day of your surgery, you will need to come wearing shorts or sweats and a short-sleeve shirt so we will have access to your leg and arms. It is important that you have nothing to eat or drink after midnight the evening before your procedure. Whereas this is a nuisance to you, it is vital for your safety as we will be using anesthesia during your procedure and need to ensure your open airway. If you take medications for heart problems, high blood pressure, or any acid reflux disease, You may take them with a small sip of water on the day of your surgery. But no food or drink is permitted after midnight, or we will not perform the procedure. The next important item of paperwork we'd like to discuss with you is your Patient Bill of Rights. I'm required to read each one to you and provide you with a copy of this Bill of Rights. As such, I will now have you read along as I explain your rights as a patient. Foot and Ankle Surgical Associates Surgery Center is a joint partnership between our physicians. While we are known for providing advanced medical solutions, it is our belief that knowledge is still the most powerful tool for you as well as us. As a patient or client, you have the right to be notified of your rights and exercise your rights in regard to your care without being subject to discrimination or reprisal. Receive safe, private, high quality and respectful care. Be provided impartial access to care. Receive medical services in a life-threatening emergency. Have your comfort needs addressed. Be informed of aspects of your condition necessary to make decisions regarding your care. Refuse treatment or services to the extent permitted by law and be informed of the potential consequences of such an action. Know the name of your physician and others who care for you. Receive, in terms you can understand, detailed information about your care, your illness, your treatment, and other services you may be receiving. Actively participate in decisions involving your care, including ethical issues, and be informed of any change in the plan of your care in advance. Receive care from personnel that are properly trained to perform assigned tasks and coordinate services. Courteous and respectful treatment of persons and property, privacy, and freedom from abuse and discrimination. Confidential management of patient records and information, except when law dictates otherwise. You may approve or refuse the release of your records. Access information in your own patient record upon request. Be informed of the process of submitting any complaints to the surgery center or a state agency. Receive an explanation of your bill and policies concerning billing and payment for services, including inquiring about the possibility of a payment plan. Seek a second opinion or choose another caregiver. Freedom from the use of seclusion or restraint of any form unless clinically necessary. Refuse to participate in experimental research. Sign an advance directive such as a living will. Be informed of the reasons for impending discharge, transfer to another agency and or level of care, ongoing care requirements, and other available services and options if needed. Appoint or have designated for you a person to act on your behalf under state law. Receive written notice of your rights in a language you understand. A translator can be requested to ensure understanding of your rights. As a patient or client, you have the responsibility to participate in decisions involving your care. Provide a complete and accurate medical history to the best of your knowledge, including information about current medications and treatments. Ask questions and seek clarification about your diagnosis, course of treatment, or care plan. Provide information about complications of health symptoms. Follow the proposed course of treatment or care, advice and recommendations which you and your provider agree upon. Be considerate of the rights of the other patients, clients, care personnel, and property. Provide accurate and timely information about sources of payment and your ability to meet financial obligations, and make it known whether you understand what is expected of you and whether you are able and willing to comply. Parents and guardians may represent or assist a patient or client in fulfilling these rights and responsibilities. Thank you for listening as we have explained the preoperative and postoperative surgical paperwork. The next step of this appointment will be taken care of by your physician and his nurse. Again, if you have any questions regarding what was explained to you or what you signed today, direct them to the physician or his nurse. We're here to make your surgical experience as hassle-free as possible.